Don't grab the metronidazole. Coptis herb works really well for that. Great studies in the journals in humans comparing Coptis to metronidazole, and Coptis is just as effective or more effective than the metronidazole at taking down the inflammation, the heat, the bleeding without destroying the gut microbiome. Every prescription medication comes with an insert that details potential risks and side effects. The problem is, most pet lovers never see that insert or are even informed of any potential risks before use. Whether you ultimately decide to use these medications, alternatives, or a combination of the two is your choice to make. The goal of this video is not to spread fear, but to educate and empower pet parents so you can ask informed questions and make the best decisions for your own pet. I'm gonna do a deeper dive in one particular antibiotic, but I am going to just go through a whole bunch of different ones. And this list is not exhaustive because there are so many things. If we talked about each one of these antibiotics individually, we literally could devote a whole session to each one of these individual antibiotics, but I'm lumping them in one. So I'm going to start running through the list. Kidney failure, amikacin, high on the list of causing kidney failure. And amikacin is an injectable only antibiotic. It is not used very often at all because of the fact that it really likes to cause kidney failure. Gentamicin is going to fall in this category as well. Both of those are given by injection only. It's pretty rare that these will be given to your animals. I used to use gentamicin way back in the day before we had so many things that we have now as an injectable quite commonly, actually, but they're really reserved for when we've got some serious resistance going on. Bone marrow suppression, chloramphenicol. Chloramphenicol was used when I first graduated. Chloramphenicol was handed out like candy. Then somewhere along the way, we discovered that it causes bone marrow suppression in people, and it can happen in animals as well. So again, it is reserved as the last ditch for really resistant infections. So when you get that report back with MRSA, multi-resistant staph, usually the last two things left that will work are usually amikacin and chloramphenicol. And so you have a choice. Are you going to kill the kidneys or are you going to kill the bone marrow? Take your pick. I used quite a bit of chloramphenicol over the years and never had a problem with it, particularly in the early days because we didn't have as many choices as we have now. But when you get chloramphenicol, a lot of times it's compounded now and it'll come with instructions that say to wear gloves. Gentamicin and amikacin, these are a class of antibiotics called aminoglycosides. They can cause deafness. Now, if you read your little bottles of ear medication, topical ear medication, very commonly gentamicin is the antibiotic in there and it can cause deafness. Your animal probably already has reduced hearing from the goo and infection and swelling that's in the ear, but the gentamicin in those drops actually can cause deafness. Destruction of the microbiome. Every single antibiotic. And it's not just destroying the microbiome in the gut, it's destroying the microbiome on the skin, it's destroying the microbiome in the mouth. It's a global disaster. Allergies, in particular penicillins and cephalosporins, because the two classes of drugs are very closely related. So if you have an animal who's allergic to penicillin, we don't use it very often, but that's going to be amoxicillin, clavamox or clavicillin, and the cephalosporins, they can be allergic to all of those as a grouping. Vomiting, diarrhea, anorexia can happen with any antibiotic and very commonly does. I did a consultation with someone today. Their dog was put on Baytril, which is enrofloxacin, and boy, knocked that dog's appetite just right out of the park. He ate nothing, really struggled with it. But the ones that tend to be the worst at the top of the list, because any of them can cause vomiting and diarrhea and anorexia, are clavamox and doxycycline. Doxycycline, you may or may not be told, that's used very commonly for tick-borne diseases, but doxycycline binds to calcium, so your animal should not receive dairy products while they are being given doxycycline. It reduces the effectiveness of the antibiotic. So I know that a lot of times we talk about using a probiotic while you're using antibiotics. You cannot use goat milk or kefir as your probiotic source if you're using a doxycycline, minocycline, anything in that category because you'll decrease the effectiveness. If your animal is vomiting with their Clavamox and doxycycline, you can try giving it with food. But what I found, and we used to use a lot of cephalexin years ago, and I got a lot of vomiting in my patients with that as well. Giving them with some food sometimes will be helpful, but sometimes you just have to pull the drug because they're not going to eat and they're just not able to hold anything down. Cartilage destruction, enrofloxacin, which is Baytril, should not be used in young growing animals. So while we're talking about enrofloxacin, in kitty cats, it can cause retinal detachment and blindness. So be very careful with it in kitty cats. The enrofloxacin is good for Pseudomonas infections. Again, that's one of those really nasty ones. You'll never forget it if you ever have an animal with Pseudomonas, because it makes a green pus and it smells. It has a very, very, very specific odor. I see it a lot on hot spots. I used to, in the summer in New Jersey, it'd be very hot and people would open their pools and their big hairy dogs would swim all the time and never get dried off. So golden retrievers, huskies, malamutes, these big hairy dogs that stay constantly wet from being in and out of the pool and never get dried off, they will develop these Pseudomonas infections. They smell awful. But enrofloxacin should not be used in young growing animals because it will destroy their cartilage. And then you have a lifetime of dealing with arthritis from cartilage destruction. So if I had a giant breed dog, I would not be using enrofloxacin before 18 months of age. And for everybody else, not before 12 months of age. And I get records all the time where it's being used on 4 and 6 month old dogs. Terrible. Antibiotic resistance can occur with any antibiotic. So if you have an animal with chronic ear infections, chronic skin infections, chronic urinary tract infections, you want to be very specific. Get cultures done. Know what antibiotic to use for whatever you have going on, because you'll develop antibiotic resistance in a heartbeat if you just jump from one to the next to the next. You want to make sure you're using the right one. You want to use these for a shorter period of time, the shortest period of time that you can. And there was a research article a couple of months ago in the Veterinary Medical Association Journal talking about not prescribing 14 days of antibiotics for urinary tract infections anymore, that really 5 days is usually enough, particularly if it's a first-time infection and we have a culture and know exactly what antibiotic we should be using. Allergic reactions, anaphylaxis, collapse, trouble breathing can happen with any antibiotic. Like I said, the cephalosporins and penicillins tend to be higher on that list, but it can happen with any of them. Neurologic side effects, seizures, ataxia, wobbliness, inability to walk, metronidazole, high on that list. The aminoglycosides, which are the amikacin and gentamicin, which are the injectables, and sulfa drugs. Sulfa drugs would be things like TMS, Bactrim, trimethoprim, SMZ-TMP. Those are all different names for the sulfa drugs. So they can have neurologic side effects. Yeast infections, definitely, because we are destroying the microbiome, screwing up the immune system. And so then we get other invaders. So we can get overgrowth of bad bacteria in the gut, like the Clostridium. C. diff, we hear about in people dying from, we had a family member, took some Augmentin, which is the same as Clavamox, for a tooth infection, ended up getting C. diff in her bowel and died. So this is not to be taken lightly. Yeast infections are also secondary invaders like ringworm or other, yeasty infections of the skin. They're going to jump on board. So what do we see in allergy dogs? Well, even cats too. What we see is use of antibiotics, and we see use of steroids, Atopica, Apoquel, Cytopoint, all these immune suppressants. And then we complain because we've got a yeast infection. Well, it's the only thing that's left to grow because we killed off everything else. All right, liver or kidney failure, tetracyclines, erythromycin, gentamicin, and the sulfa drugs. They're at the top of the list. Any antibiotic could potentially cause these, but these are the ones that are most likely to cause liver or kidney failure. Tetracyclines, erythromycin, gentamicin, and sulfa drugs. Potassium deficiency can occur with any antibiotic. It can be from vomiting. It can be from excess thirst and urination, the kidneys flushing too much potassium out. Nutritional deficiencies that can be seen with use of antibiotics. They inhibit the availability of vitamins A and B, magnesium, zinc, and folic acid. So folic acid, really, really critical for gut function. And so is magnesium. Magnesium is also really critical for heart function. And zinc deficiency is a huge problem for animals with skin disease, skin problems, allergies, skin issues in general. So when we keep using these antibiotics, we keep getting these animals more and more and more deficient. We can see hair loss, particularly with the tetracyclines. The sulfa drugs can cause anemia. They can suppress the bone marrow just like the chloramphenicol did. Sulfa drugs also can cause joint pain and swelling, what we call joint effusion, which is fluid production within the joints. The joints swell up. They're very painful. Seen most commonly in black and tan dogs. Sulfa drugs are not recommended for use in Rottweilers, Dobermans, Dachshunds, any of those black dogs with the brown points like that. The joint pain and swelling usually will disappear when the drug is withdrawn. But years and years ago, when our options were amoxicillin, sulfa drugs, and chloramphenicol, we used a lot more of them, and we would get these dogs coming in who were not able to walk, were really, really, really painful. Then we were putting them on some sort of anti-inflammatory or immune suppressant. It's not the way to do it. Just get rid of the drug. And if you have a black and tan breed like that, I would certainly recommend not using it in those breeds. Leaky gut syndrome, they're all going to cause that. So if your animal has been on antibiotics, we do recommend using the leaky gut protocol, doing the liver detox, getting good probiotics on board. It's really, really critical that we rebuild what we just destroyed, and also that we detox the body, because these are being metabolized and eliminated by the liver and kidneys. That's what those organs do. Damage to teeth. Tetracyclines can destroy the enamel, particularly in animals who still have their baby teeth. So when their adult teeth come in, they won't have good enamel on them. We talk about this in tetracyclines all the time, and most veterinarians know not to prescribe tetracyclines for animals who still have any baby teeth. So anybody under like 8-9 months old should not be put on tetracyclines, but I see it very commonly with young animals with upper respiratory infections. Tetracyclines are used very commonly. It's wrong. It's wrong. We're destroying their teeth. Now we're going to have a lifelong dental issue because we use the wrong thing. My son had pneumonia when he was year and a half, 2 years old, and he was prescribed amoxicillin. You know, we use amoxicillin in our children all the time for ear infections and this, that, and the other thing. And he was on amoxicillin for quite a lengthy period of time, and it destroyed the enamel of his teeth. Amoxicillin is not labeled as causing that kind of issue, but it did. So the one that I'm going to focus on at the end here is Convenia. Convenia is an injectable antibiotic that was originally, well, I think it's still labeled for use in cats, but it's being used off-label quite often. So it was originally made for injectable use for kitty cats with abscesses, particularly bite wound abscesses. Usually when we're seeing bite wound abscesses in cats, it's the kitty cats who go outside, may not be that great at being handled all the time. And anybody who has tried to medicate a cat once or twice a day with pills or liquids knows that they have 75 weapons. They do not have 18 weapons on their feet. They've got those plus the ones in their mouth, and they find a few more, and they will take you out. So nobody wants to medicate a cat. So they came out with Convenia injectable, and it was labeled to treat cat abscesses, particularly for, you know, you have an outdoor cat that's hard to catch, you bring it in, one and done, poke it, good to go. Problem is, once you put it in, you can't get it out. And it is in that sort of cephalosporin class. So allergic reactions can happen with a reasonable degree of times. So we do see allergic reactions to it. And again, you put it in, you can't get it out. The bad news is it stays in the body for 8 to 10 weeks. It's labeled that the concentrations of antibiotic at a therapeutic dose stays for about 2 weeks. It says in the literature, 1 dose only for cats. Never repeat it. Like when the 2 weeks wears off, you don't give another one. Well, I've seen it given repeatedly in many records. Dogs potentially could get a second injection, but it's not labeled for use in dogs anyway, but people are using it in dogs for skin infections. Again, once you put it in, you can't get it out. You should not give it to animals who have any kind of liver or kidney disease. So again, how many of these cats are having their liver and kidney values, or dogs, tested prior to being administered that injection? Very few. Vomiting, diarrhea, anorexia can happen with any antibiotic. We would like to think that maybe it would be less with an injectable, but it's not. It can cause ataxia, wobbliness, hyperactivity, particularly in dogs. So we know it's affecting the nervous system. It affects the liver and causes increased liver enzymes, specifically ALT and GGT, which means there is active destruction of liver cells going on. The really bad ones, kidney failure. It can cause kidney failure. And it can cause bone marrow suppression. It is myelotoxic, which means it is toxic to the bone marrow. And this is why you only give one injection. You don't repeat the injection. And when we get that myelotoxicity, you'll get anemia and low white cell count and death. Can't reverse this one. There is no antidote for this. The other thing is it was originally labeled for use in abscesses and basically a skin problem, but it's being used off-label because it's convenient for the veterinarian to give your animal that single shot and say, okay, you're all good, don't worry about it. But it's being used off-label for other things. It's being used a lot for respiratory infections. There's nothing in there that says this is supposed to be used for a respiratory tract infection. It's not labeled for that. It's not useful for that. It's being used a lot for urinary tract infections because it works against E. coli. So if you know you have an E. coli, which you would only know if you had the culture done, then you're going to get a list of antibiotics that you could use. I would not choose this one. Choose something else. This particular drug, because of the way it binds to proteins in the body, will if your animal is also on carprofen, which is Rimadyl, furosemide, which is Lasix, doxycycline, or ketoconazole, it will increase the concentrations of those drugs. Let's say you have a cat with heart disease who takes Lasix, and then you get this injection. Their Lasix is going to be more concentrated in their bloodstream. So we could end up with more kidney problems, more dehydration. If they're on any kind of an antifungal, like the ketoconazole, like we talked about with, I believe, cyclosporin the other day, the Atopica, it's going to change the concentrations in the blood. So again, if you're playing polypharmacy, or your veterinarian's playing polypharmacy where you have a whole bunch of medications going on board, make sure somebody looks up the drug interactions and how it's going to change what's going on in the body. So what can we do to avoid overuse of antibiotics? One, if you have an infection, get a culture. So there's blood in the urine, the animal is straining, urinating outside the box, wanting to go out more frequently, get a urine sample checked. If the urine sample supports a urinary tract infection, get a culture. Now, yes, they might be a little bit uncomfortable while you're waiting a couple days to get the culture back. You know, the worst thing that can happen is you drop it off on Friday night and you're not going to have results till next Wednesday. That's just kind of the way it is. So what can you do to make your animal more comfortable? Well, you can use things, and I'm talking urinary right now, we'll talk about other things. You can use things like cranberry, whether that's fresh grated cranberries in the diet, a cranberry extract, a cranberry pill, a cranberry powder. You can use D-mannose, you can use licorice, you can use marshmallow root, a lot of different things to try to help soothe that bladder. If you have an animal with IBD that is prone to bloody diarrhea, your veterinarian, the first thing they're going to grab for is metronidazole. Metronidazole, and there was just another article on this in the veterinary journal. I talked about it a couple of months ago, where some of the doctors are now saying, hey, maybe we shouldn't be reaching for that metronidazole and destroying the gut microbiome. Maybe we should be fixing the gut microbiome and taking down the inflammation. I've got a blog on summer damp heat that talks about IBD, colitis, heat in the bowel, which is the blood and the mucus in the stool. Don't grab the metronidazole. Coptis herb works really well for that. Great studies in the journals in humans comparing Coptis to metronidazole, and Coptis is just as effective or more effective than the metronidazole at taking down that inflammation, the heat, the bleeding, without destroying the gut microbiome. So we want to look for alternative things. Look for things like gastro elm, which has slippery elm and marshmallow root and some of these herbs that can be soothing to the bowel. Get them on a cooling diet and something bland, easy to digest if they've got blood in their stool. If they've got oozy skin or sores on their skin, is it something that could be handled with a TheraClean bath? We've talked about those for the allergies. TheraClean, it does not use detergents. It does not destroy the microbiome, but it gets in and bubbles out the bacteria, and Demodex, if it's sitting down there in the hair follicles, can be very, very effective without having to resort to the drugs. The biggest problem is finding a groomer or veterinarian that has a TheraClean system. We want to leave the microbiome intact rather than destroying it. Use topicals. You can use herbal ointments. Wound Balm by Buck Mountain is phenomenal. I used it for a dog that had a MRSA, where a feeding tube had been placed and taken out, and she had MRSA in that area. She was a 12-pound dog, put on enough Baytril. She had a combination of Baytril and Clavamox, I think. And she literally was put on enough for a 200-pound dog by the university. And I took all the medications and looked at them and said, oh, there is no way I am doing this. And I literally just used the Buck Mountain Wound Balm on the site, cleared up, no further problems. All we had to do was use an herbal medicine. Look to other options instead of always running for the antibiotics. Certainly if your animal has a pneumonia, okay, we may have to do some things here. We got to get on top of that. So we need to be nebulizing. We need to be opening up those airways. We need to feed diets that are going to support good health. We need to get the microbiome back in shape. The big thing that I would say is if you think your animal needs an antibiotic or your veterinarian wants to prescribe an antibiotic, make sure that you know exactly what it's being used for. And how did you determine that this is the antibiotic that needs to be used for that? Monitor them very closely and ask what's the shortest period of time that you can use that antibiotic and get the effect. Because I'm telling you, dermatologists, when they grab for antibiotics, they prescribe 4 to 6 weeks at a time. It's just a destruction cycle. It just keeps putting you further and further and further behind. So that's kind of the quick rundown on antibiotics. Like I said, we could dive, I dove into the Convenia a little bit more just because some people said their cats were killed by Convenia, and because it's used off-label and it's just very commonly used because it's long-acting injection and everybody wants the simple route. It's sort of like if you can give a pill that's going to prevent flea and tick infestation for 3 months and you only have to do something 4 times a year. Wow, that's so convenient. That sounds great. We should probably do that. No. Here, we can give this injection. It'll prevent your dog from getting heartworms for a whole 12 months. You don't even have to think about it. We'll send you a reminder. Yeah, convenient. Good? No. Really bad. This one is called Convenia because it's convenient. It is convenient to give that 1 dose and not have to medicate your animal anymore after that. So don't go for convenience, folks. Go for good health. Let's go for restoring the microbiome everywhere on the body. Let's go for stopping the destruction. Feed species-appropriate, high-moisture diets that are going to help keep your animals healthier.